Hello, everyone. Thanks for joining us today. I'm Jana, and I'm going to be the moderator. I'm here with Dr. Valerie Chen of Providence Eye. She's an ophthalmic plastic and reconstructive surgeon with us. We're very excited to present Look Younger Without Surgery today. With that being said, I wanted to let you know that in the GoToWebinar panel, there's actually a question section. At any point that you have a question for Dr. Chen, please feel free to ask the question and I will address it to her at the end. Without further ado, I'd like to introduce Dr. Chen.
Jana, thank you so much. Thank you all for joining me today on this beautiful Friday and to talk about different ways that we can look younger without surgery. Again, my name is Valerie Chen. I am a board certified ophthalmologist and an ASOP certified ophthalmic plastic surgeon here at Providence Eye. So when we look in the mirror, what are we seeing? You may notice crow's feet, and those are the little lines that spread out from the outer corner of the eye. Forehead lines are those horizontal lines between your hairline and the brow. Frown lines are sometimes called 11 lines. Those are the vertical lines between the two brows. Marionette lines, those are the vertical lines that extend down from the corners of the mouth towards the chin and can sometimes make you look a little bit sad. It pulls those corners down. With age, we also lose volume in our cheeks or deflated cheeks. We can get some bags or circles under the eyes. We sometimes call that the tear trough. And we also lose volume and definition in the lips, sometimes even getting those little vertical lines above the mouth. Why does this happen? As we get older and wiser, our skin loses its normal collagen and elastin levels. And so your skin doesn't have the same tone. It loses its ability to snap back. We lose volume through muscle weakness, bone loss, fat loss. The skin gets thinner and drier with time. And repeated facial contractions, you bunch up those muscles, starts to form lines that can slowly get etched in. There are certain lifestyle habits that can contribute to this: sun or UV exposure, stress, smoking, alcohol, drug use, unhealthy diet. The good news is there are things we can do about this without surgery, and the popularity is just really going through the roof. The top two most popular surgeries are botulinum toxin A and soft tissue filler, with over millions and millions of these being performed each year. So some popular brand names that you may have heard: BOTOX, Juvederm, Restylane. BOTOX is a botulinum toxin A. There are other brands called Dysport or Regimen, and those are used to treat dynamic wrinkles or lines that form when you animate your face, contract certain muscles. Juvederm and Restylane are fillers that are used to treat static wrinkles or wrinkles that are present even when your face is totally relaxed, you're not contracting any muscles. So a lot of folks do these injections. There are other doctors, dentists, even in some states, physician assistants, nurse practitioners, estheticians can all do these procedures. So why go to an oculoplastic surgeon? Well, I went to medical school for 4 years, 1 year of a medicine internship, 3 years of an ophthalmology residency, 2 years of an ophthalmic plastic and reconstructive fellowship. And that's really all just to say I spent a lot of time studying the anatomy and physiology of the face, the muscles, how to treat it with surgery and non-surgical methods, the appropriate dosages of these different treatments. But it's not just a science, there's an art to this. And that's one of the things I really love about what I do, is that each and every patient is unique, and we get to come up with a plan together to get you to your desired goal and outcome. So let's dive in. BOTOX, again, this is used to treat dynamic wrinkles or wrinkles that form when you animate, contract certain parts of your face. This is FDA approved for moderate to severe frown lines, those 11 lines, the forehead lines, and crow's feet. There's some other common but off-label uses, such as a mini chemical brow lift. We can do a lip flip to try and increase the projection, or even into the masseter or the jaw to try and soften some of that jawline. Typically, treatment takes only about 10 minutes, and I like to go over the rule of threes. So it takes about 3 days to kick in after the injection, 3 weeks to reach full effect, and an average person, it lasts about 3 to 4 months. When you come in, again, I'll hold up a mirror. We'll review your areas of concern. For some people, they like their crow's feet because it means they smile. Other folks say, nope, please smooth those out. I don't want to see those. In the forehead lines, some folks, they like having some movement, some ability to show expression and animation. Other folks will tell me, I want that really smooth. I don't like seeing any lines there. So once we get a good game plan, we'll do these injections into specific areas to target different muscles. The injection will feel like a little pinch, and you may even notice a little temporary red bump where the injection was done. That typically fades on its own over an hour. Please don't massage those bumps. That medicine is placed in a very specific area, and we don't want it to migrate elsewhere and work on a different muscle that was not intended. Rarely you may notice bruising, and this has minimal to no downtime. So you can even come in over lunch. We do these injections, pick up lunch on your way back to work, easy peasy. So this is, I think, a really neat before and after photo of one of our very own patients. We were treating the smile lines. So again, these are the little lines that radiate out from the outer corners of the eye. So here, this was before treatment. In this particular patient, we did 6 units on the right. And you can see how even just after 1 week, how nicely that smoothed out. And same thing on the left. These smile lines, we put in just 6 units to soften these lines and much smoother. So BOTOX is used to treat those dynamic wrinkles, but as you continue to make certain facial movements, in addition to those natural body changes and lifestyle habits we talked about, those lines can start to become etched in so that even when your face is completely at rest, you'll notice lines just present. For this, we used soft tissue fillers. I personally like hyaluronic acid fillers. The most common brands are Juvederm and Restylane. Hyaluronic acid is a naturally occurring substance that is already found in your skin, and each Juvederm and Restylane has an entire family of fillers to add volume, lift, smooth out different areas of your face. And each of these products has different properties to try and enhance those different parts. So in some areas, you still want some more movement. You may want a softer fill, plumping. Other areas you want a little bit more dramatic. We use something a little bit heavier. The hyaluronic acid filler, again, it's a gel-like substance that we inject in to replace some of that lost volume, to smooth out those static wrinkles and help plump up the skin. Treatment can take anywhere from 15 minutes up to an hour, and the results are really immediate. So a lot of times we'll start doing an injection on one side. We'll hold up a mirror so you can see the treated versus untreated side just to see that difference. It's really incredible. The filler can last anywhere from 6 months to 2 years, and it depends on which product we choose and where it is injected. So when we're doing injections into the filler, we may try to plump that up, add a little bit more projection, but you can imagine your lips are constantly under a lot of stress when you speak, when you're eating or drinking. And so filler in the lip lasts maybe 6 months up to 9 months. If we're putting filler into the cheek to build up some of the lost volume there, we typically use something that's a little heftier, has a little more oomph to it, and it's not under nearly the same amount of wear and tear. So filler in those areas can last up to 2 years. What can you expect? Again, we'll hold up that same mirror. We'll talk about what effect you're looking for, what bothers you, what doesn't bother you. The injections can have a little bit of discomfort involved. We try to minimize that with ice and topical numbing cream. And as the injection proceeds, it tends to become more comfortable. And that's because the filler itself is mixed with lidocaine numbing medication. So you may notice a little bit of discomfort at the beginning, but that typically gets better. And again, there's very little to no downtime with filler procedures. So who's a good candidate? Really anyone over the age of 21. Non-smokers typically have tissues that respond a little bit better and a little bit faster. We can treat mild to severe facial lines. We do every skin type, color, texture, but most importantly, it's having that conversation about what can and cannot be achieved with these minimally invasive procedures. You can prepare by stop smoking at least 2 weeks before and after your treatment. Do not take over-the-counter pain medication other than Tylenol 2 weeks leading up to your procedure. Things like Advil and ibuprofen can have a little bit of a blood thinning effect, so it may worsen any bruising and swelling after the procedure. And cancel your appointment if you're not feeling well. Get yourself better. We will get you in once you're feeling better. So taking care of your skin and yourself after these procedures, live your healthiest life, eat well, exercise, alcohol in moderation, and especially if you can hold off in the first 24 hours after the procedure. Alcohol can dilate your blood vessels. And that's why if I have a glass of wine, I'll sometimes get a little bit of that flush in my cheeks. Those blood vessels open up, and again, it can make you a little bit more prone to bruising and swelling. Stop smoking, wear sunscreen, hats, and sunglasses, and you can use professional grade skincare products such as SkinCeuticals. We recently brought on SkinCeuticals to Providence Eye and Laser because I found that these procedures or these surgeries didn't fully address what my patients' concerns were. Skin quality and texture is very important. It goes hand in hand with BOTOX and filler. SkinCeuticals was founded by the former chief of dermatology at what I like to call the other school, or Duke. And he had done a lot of his research. He has a lot of patents in vitamin C antioxidant treatments for the skin. The skin is the largest organ in the body. It's your first line of defense to when you go outside, the sun, that UV exposure, the car exhaust when you're starting your car in the morning, or even when you just, without even realizing it, touching your face. All of these things cause wear and tear, free radical damage that accelerates aging changes to the skin. This serum, the CE Ferulic, is one of their most popular products. And what it does, it provides advanced environmental protection from these things and improves the appearance of fine lines and wrinkles, loss of firmness, and brightens the skin complexion. If you look to the right, this is an experiment that they did. They had patients use the CE Ferulic once in the morning for 4 consecutive days, so 4 days only. And then they were brought into the lab and given a sunburn. That sounds like, I don't know who would volunteer for this, but they did, and they gave them a tough sunburn. And this right here that you see, this is an untreated patient, so you can see a fair amount of redness and swelling. This is that patient that was treated with just the 4 days of CE Ferulic, significantly less redness, significantly less swelling. And this bottom line here, these are other patients that used other vitamin C serums that are out on the market. And again, none of them really come close to comparing to the degree of protection provided by the CE Ferulic. Some other products by SkinCeuticals, HA intensifier. That HA stands for hyaluronic acid. And again, when we're doing that filler, we're injecting hyaluronic acid. This serum, it amplifies your body's natural hyaluronic acid levels to improve the firmness, texture, and plumpness of your skin. So if you look in the upper right corner here, this is a baseline photo. And then in the middle, this is someone who's been using the HA intensifier serum twice a day. So it's once in the morning and once in the evening for 12 weeks. And then the far right, you see the overlay for the improvement in volume, green being less, red being maximal increase in volume. Triple Lipid Restore is their anti-aging cream, and I'll just draw your attention over to the pictures. I feel pictures show a lot more than I can say. You see these lines here that are deep etched in. After 8 weeks of treatment in the morning and in the evening, you can see the lines are softer, not quite as noticeable. The AGE Eye Complex is their anti-wrinkle eye cream that has both immediate and long-term effect. The immediate helps with some of the dark circles and the puffiness. The long-term effect helps smooth out some of this skin here. You can see how it looks a little crepey. Those fine lines are present. After 12 weeks of treatment in the morning and in the evening, the quality of that skin has really improved, and this is without any other interventions. No laser, no filler, no Botox, etc. This is just that anti-wrinkle eye cream. Retinol, I think, is a very important part of any skincare regimen. It promotes skin cell turnover, improves the appearance of fine lines, wrinkles, pores, and helps to even out the skin color and blemishes. It's used in the evening time. And what I like about their retinol, it comes in 3 different strengths, the 0.3, 0.5, and 1.0. It does a steady, even release throughout the night. So if you've tried other types of retinols or even prescription tretinoin, it can be a little tough on the skin where you notice some redness, irritation. So if you're prone to sensitivity, this can be a lot softer to sensitive skin while still giving you those benefits of a retinol. SPF is an incredibly important part of any skin regimen as well. You want to make sure that you've protected your sun from that UV radiation. So this is a sample regimen that some of our patients use. There are some products they'll use just in the morning, some just in the evening, and some that you'll use twice a day. If you say, oh gosh, this looks intimidating, please don't be intimidated. Reach out to our team. We'd love to talk to you more about something that's feasible. If you say, well, this looks great, but I have other areas of concern. I notice my neck is looking a little bit, I see some lines, it's getting a little bit stretched out. We can help tailor a regimen just for you and your specific skin concerns. So what is the cost? Botox, filler, skincare, these are all cosmetic treatments that are not covered by insurance. Botox Cosmetic, on average, we charge $12 per unit, and that is performed by myself, Dr. Chen. I do not delegate this. It is not done by someone else. You and I will talk through what your goals are, and then I myself will perform the injection. A syringe of filler can cost anywhere from $400 to $800. Really, that selection depends on where we're placing it in the face. Most patients will start with either 1 or 2 syringes. If you want a more subtle effect or you have just mild lines, we probably will use just the 1 syringe. If you have some deeper etched in lines, more severe wrinkles, or you want a more dramatic look, we may use 2 syringes. So over the next few minutes, I'll answer some of the most common questions I hear about Botox and these fillers. If I don't touch on something, please don't hesitate to click on the side in that question area. Jana's keeping an eye out for you. So do these treatments hurt? Again, the Botox cosmetic injection feels like a poke. The needle we use is one of the smallest on the market. It's about the size of a hair or two, and it's just a transient discomfort, generally pretty well tolerated. Fillers can be associated with a little bit more discomfort. We try to minimize that with ice and a topical numbing cream. And then again, as that filler procedure continues, the natural lidocaine that's mixed in there starts to kick in and keeps you more comfortable. Are these treatments safe? Botox, Juvederm, Restylane are all FDA-approved medications and procedures. Common side effects may include redness, pain, a little bit of bruising, or a drop of blood at the injection site. There's a rare risk of infection. Botox works to weaken specific muscles so that you cannot form those lines. If that medication goes to other muscles, it can cause drooping of the eyelid or change the brow position or shape. And sometimes we do that purposefully, like in a mini chemical brow lift. Fillers, some of the other risks include hypersensitivity reactions, granuloma, nodule formation, or just lumpy bumpiness. One of the things I always keep in the back of my head is the risk of, if we inject some of that filler, that's gel-like substance, into a blood vessel, it can cause vascular compromise where you don't get adequate blood flow in that blood vessel. If that blood vessel leads to the skin, it can lead to skin death or skin necrosis, or heaven forbid that blood vessel goes towards the eye, it can lead to vision loss. And that's why it's so incredibly important that you have someone who knows the anatomy incredibly well doing these procedures and using the appropriate safe techniques for this. Now, if this, heaven forbid, happens, let our office know right away. There are certain things we can do to try and open up that blood vessel and reestablish that blood flow. What is the right age to have these procedures? So really anyone over the age of 21 that is starting to notice lines. We can even do these to prevent early signs of aging. For example, my mom, she had some pretty deep 11 lines, and I think I must have given her a fair amount of headache when I was younger. And with time, those 11 lines have started to get etched in a little bit more, so that even when she's at rest, she has a little bit of those faint lines already present. Will I still look natural after the procedure? Our goal is for you to look refreshed, not drastically altered or like someone else. And that's why I think it's so important that we sit down and have that conversation before proceeding, because natural, refreshed means different things to different people. Again, some people want the forehead completely frozen. They don't like any of those lines. They like it smooth. Others like that expression to show that they can smile, that they can look surprised. And so once we come up with a good game plan with what your desires are, we can treat accordingly. If this is your first time or you're not sure, I will always err on the side of doing less. Once we inject that Botox medication, there's not a way to take it out. We just give it time to wear off over those 3 to 4 months. So I start with a little bit less, give you that 2 to 3 weeks to reach full effect. And if it's still not quite enough, we can always give you a little bit more. We can do that touch up as needed. What if you want more drastic results or you want longer lasting results? Then we're moving into the more surgical end of the spectrum. And if this is something that you want to talk more about, please visit our website for more information or check out the webinar that we did last month regarding eyelid surgery. If any of this is appealing to you or you say, hey, I'd love to learn more, go to our website, providencei.com/contact-us. There's a form there, and in the comment section, you can talk about what you're specifically interested in, and our team will be sure to reach out to you shortly.
All right, thank you, Dr. Chen. Just opening up the question panel. Feel free to ask any additional questions, but I'm going to go ahead and get started. Are the SkinCeutical products prescription based?
These are not prescription based, they're medical grade, but they do not require a prescription.
Cool. So they can just come to the practice and pick up what they might want, or how would they?
Absolutely. The best way to start is still just going to that website. Because of the safety precautions we take, unfortunately, you cannot just drop into the office. We want to make sure we don't have too many people in the given area at a given time. But you can just call our office or go to the website.
Perfect. So this is a kind of a one-off question, but I think it's relevant. So the person says, my daughter who received Botox for TMJ has outstanding results. I have milder TMJ and I'm interested in that. Do you do that? And then also that same person would like to alleviate the bags under her eyes, but she's had an IOL. Is the treatment safe for someone who's had that?
So let me start with the TMJ. So that is generally the muscle called masseter that can really clench down and cause issues there. We can certainly inject Botox into that area. In very severe cases, insurance can cover that. Our office is not set up for that. Typically, you need to then go to an ear, nose, throat, or a dentist if it's at that level of severity where insurance might cover it. In regards to if you've had cataract surgery, we can certainly still address under eye those bags. Depending on what the cause of those bags are, surgery versus filler, it's difficult to say without seeing you in person, but if you set up an appointment, I would love to take a look and chat with you further.
Okay, how long does the filler versus Botox last?
That's a great question. Botox and filler are used to treat different problems. Now, a lot of times we'll do both in a single patient, but again, Botox is used to treat dynamic wrinkles. So if I'm frowning at my husband, I get those 11 lines. When we put Botox in, I can't look angry at him. But if I've looked angry at him for so long that those 11 lines are present, even when I'm not trying to look angry, then we use filler to fill in those little lines. Botox, again, will last about 3 to 4 months on average. Filler, depending on which filler we choose and where we place it, can last anywhere from 6 months to 2 years.
Great. Do you offer dye sport? And if so, what is the cost per unit?
I'm sorry, can you say that again?
Do you offer dye sport injections?
Oh, so Dysport is another type of botulinum toxin A. I personally prefer the Cosmetic Botox. It is the first medication, it's the best studied, and I find that we've typically had a little bit better result. Dysport can migrate a little bit more, and so I find that I've had a little bit more frequency of other complications where you may get a little bit more eyelid drooping. So I personally do not use Dysport.
Okay, and so can I have the procedure the same day as I come in for the consult?
Yes.
Perfect. And then also, can flexible spending or HSA dollars be used for these procedures?
If you, I might defer that to our billing team.
And actually, I can answer that. The answer is in most cases, no. If there's a medical reason, on occasion, HSA or FSA will cover it, but in most instances, the answer is no if it's for cosmetic purposes.
Thank you, Jana.
Yep. Okay, let's see if there's any additional questions. I'll give everybody one more minute here to send them in. It looks like we have answered all the questions today, Dr. Chen. So thank you everyone for attending, and thank you for your time, Dr. Chen. We will send a recording out probably early next week for attendees here. So if you want to rewatch this or you weren't able to see the whole program, we'll deliver that via email next week. We hope to hear from you in the near future. Everyone have a wonderful weekend.
Thank you all so much.